Episode 233 of The Art of Living Proactively. And in this episode, pediatrician and life coach Sheila Carroll discusses helping parents improve their children's health through lifestyle changes rather than focusing on weight loss. She talks about the common health issues seen in children today, like obesity, anxiety and depression, and how things like poor nutrition, lack of sleep and exercise, and excessive technology use contribute. She recommends eliminating sugary drinks, reducing ultra-processed foods and making simple changes like improving sleep habits. And she talks about the importance of parents leading by example and says children cannot successfully make health changes on their own. So that's some of the things that we discuss in this episode. There's a lot more as well. So if you do enjoy this episode, please do subscribe. Leave us a review on the App Store, either the Apple one or the Google one. That would really be helpful for more people finding out about the show. Hope you enjoy this week's episode. Welcome to another edition of The Art of Living Proactively. My guest today is Sheila Carroll, and we're in Maine, aren't we?
Yep, I live up in Maine, which is about 2 hours north of Boston and about 5 hours north of New York City in the U.S.
So what is a native from Maine called? A Mainian or what?
Well, Mainer is like
okay.
Some people call us maniacs, but we use the term Mainer, like a native Mainer, which I am, born and raised here.
I don't know if you're familiar with, a few years ago in England, we had a whole thing about leaving the EU, that Brexit, and
yes.
there were two opposing sides. There was the Brexiteers and the Remainers. So it sounds. Yeah. Okay. Well, Sheila, I know that you're helping sort of children and with weight loss, and your life coach as well. Maybe tell us a little bit more about what you do.
Sure. I am I'm a board certified pediatrician and an obesity medicine physician. And about, a few years ago now, I became a certified life coach. And I currently work helping parents of kids. So I'm a pediatrician and I spent, 20 plus years, just dealing with sick children. I usually work in the hospital, to tell you the truth. So when kids are sick enough to be in the hospital. But the last few years of my career, I worked in a clinic, in an office, and I was seeing a lot of kids and families struggling with lifestyle problems, really, I guess I would say. One would be carrying extra weight, lots of anxiety, some depression, poor school performance, poor nutrition, not getting enough exercise. So I was seeing this and how the children were suffering, number one, but also how their parents were struggling. And I decided to try a new approach. I still want to help the children, but I'm doing that by focusing exclusively on helping the parents. So I help the parents, I kind of coach them, educate them, empower them to set up the healthy lifestyle for themselves first, so that they can be the role model that they want their children to have.
And so is it a case of where children are suffering or have obesity that the parents often do as well, or not?
Sometimes, but not always. We don't know exactly what makes one person more prone to gaining weight easily than someone else. For example, myself, I'm one of 5 kids, and I became an overweight child when I was around 10 years old, but 2 of my siblings never struggled at all. And we all ate the same food. So, I think over time I ended up eating more than them, because the way that extra weight or extra, fat tissue, adipose tissue, the way that works, it actually makes you hungrier. So that's part of the issue for people. But, so we don't know, why some people gain weight more easily than other people. So sometimes kids who are struggling have parents who are also struggling. And sometimes the parents aren't struggling with weight, even though they're eating the same food as their child. So it could be either way.
So for parents who maybe aren't struggling with weight issues and their children are, would it be much more confusing to them? Why is this happening to my child when we're not?
Yeah, exactly. Exactly. Yeah. And there's usually some, kind of obvious things that we can look at right away. I look at 4 big areas: nutrition, sleep, movement or exercise, and then emotional regulation skills, and basically tie that to emotional eating and trying to prevent things like that. So parents can help identify, or, parents can say, well, I wonder what my kid is not sleeping very well, or he's using the screen all the time. So there's definitely places to correct. The vast majority of kids that are struggling with extra weight are doing so because of the lifestyle factors in combination with their personal biology. So there are a few very rare genetic disorders where people have, are prone to gaining weight. But those are exceedingly rare. So this is the beauty. This is the good news. If parents can, if parents can change the lifestyle that the child is living, then their child will benefit from.
What was it that drew you towards this in the first place?
Well, I think my personal struggle, to tell you the truth, was one thing. Like I said, I struggled as a kid. I struggled as a teenager, as an adult, off and on. And it really affected my life in a lot of ways. Deeply, deeply affected how I felt about myself. And now that I'm kind of solved the issue for myself, sort of figured it out, and I know it's a way that can help other people, I feel so driven or inspired or trying to get this knowledge into the hands of parents so parents can prevent their kid from ever having to go through decades of struggle or, years and years of living in a body size that they don't want to. And it's more of than just the size of your body or the number on the scale. What my approach is really focusing on health, and it doesn't honestly 100% matter what the number on the scale is. That's kind of a marker of some other health behaviors that if that number's higher than you want it to be, or higher than a doctor is telling you it should be, it's probably because of some habits that you have that
Right.
If you alter those habits, your whole health would improve.
Right.
So this is the thing, we're now seeing Alzheimer's disease, or, cognitive decline in older people, and in older people. It starts as when you're younger. It's not just all of a sudden you're 60 and your brain, hits the skids. It's that's been building up over time because of things you've been doing, probably unwittingly, unknowingly.
Yeah.
So if we can teach our kids and instill in them a healthy lifestyle from the get-go, they can prevent, type 2 diabetes, prevent lots of cancers are associated with extra weight. And so so we really are looking at health and not weight. So it's not a diet. We're not putting any kid on a diet. We're not restricting, but we're looking okay, what foods do we need to be eating that are going to serve your body? What about sleep? What about moving? What about learning how to manage your emotions?
I guess for parents, it's so difficult because it's a real minefield with misinformation and disinformation, and the internet and in media and so on. And so it can be difficult to know which is the right advice to follow, I guess.
I know, even myself, I even as a doctor, there are doctors who are saying plant-based is the best way to go. This is how you achieve like optimal health. There's other doctors who are saying, nope, carnivore, keto, this is the way you achieve. So I agree. It's very, very confusing. It can be.
Yeah.
But if we let ourselves get mired down in that confusion and do nothing,
Yeah.
I think the one thing that both of those groups, almost every single person that you would talk to, would agree that highly processed foods, these ultra processed foods, the foods that have been created in the last 50 or 60 years, those are not working for our bodies. We are a very ancient human body that's evolved over millions of years. That food, which has been created, to sell, to make money, to keep us buying it, and it tastes good, it's not working for our health, our mental health, or our physical health. And so that's the one thing I think parents, you don't need to subscribe to a certain way of eating, a certain keto or paleo or whatever. But if you can shift your family to more real, whole, unprocessed foods, your health and your child's health will greatly improve, dramatically.
So you've been a practicing pediatrician for more than 20 years.
Wow.
So what are the sort of common health issues you've seen in children, and how can parents kind of proactively address those?
Well, obesity is one really common. I think, the latest data, it's pre-pandemic. And we know that the rates of weight gain were going up during the pandemic. But 20 to 30% of children, at least in the US, were considered overweight or obese based on their BMI. So that's one issue that kids are facing. Kids are facing a lot. And then that comes along with other issues. So then you might have we are seeing earlier and earlier kids having liver problems. It's called non-alcoholic fatty liver disease. So you're eating mostly foods, ultra processed foods. This doesn't happen to kids who are eating real, whole, unprocessed food. So what's happening is you're getting a big fructose load, and, your body is doing its best, trying to help you out. Like, hey, where can I put this stuff to say, it's coming, it's here. What do I do with it? But it might store it in your liver, and that crowds out your healthy liver cells. And now you have liver disease, liver problems. So we're in type 2 diabetes, pre-diabetes, high blood pressure. And we know there's social and mental health effects that go along with extra weight. Kids don't feel good about themselves. They have lower self-esteem. They're more prone to anxiety and depression. And so outside of that, in my office, I was seeing a lot of kids with anxiety and depression in general. Even kids with, quote, normal weight, or, who wouldn't be considered to be carrying extra weight. I think that's a really common health worry for parents or for kids and their parents these days. Yeah.
So you mentioned about that rather than focusing on the weight, you try to focus on improving health.
Yes.
How easy or difficult do the kids find that?
Well, here's the beauty of it. It's difficult if you are the child and then all the information's being directed at you, and you're the one left to make these decisions and changes for yourself. And that's kind of what, at least here in the US, what our medical system is set up to do. People would bring their child to me who is 10 or 12, even 15, and they'd be like, here's my child. He's struggling with extra weight. Talk to him.
Right.
And, okay, I can talk to him. But, couple things are wrong with that picture. Number one, in no way at all do we ever want to make a child feel like something is wrong with them, or create worry about themselves, So, the other thing is kids' brains young adults' brains are still immature until they're about 26 years old. So what we're talking about is the development of the prefrontal cortex, the part of your brain that lets you, like your podcast title talks about, live on purpose or live proactively. You need a highly functioning prefrontal cortex to make that happen. You need to be thinking a couple steps down the line, like your future self, especially when it comes to something like health, weight or health. Like, okay, I could eat these, I could eat these Doritos, or I could eat, something healthier, an egg or something if I'm hungry, what I say to myself is future Sheila tomorrow, future Sheila 2 weeks from now, she'll be happy she ate an egg instead of the Doritos. I say that to my son who's 11, and I'm like, Theo, what would future Theo? And he's like, Mom, I don't care about future Theo. Which he doesn't, because he's 11 years old. He wants what he wants in the moment. Over time, I'm going to keep talking to him about that. And as his brain ages and matures, and he goes down that road to adulthood, his brain will be able to understand. But when we try to talk to kids, if someone brings their child to me in the office, okay, child, less unhealthy food, more movement. Get yourself to bed on time. Like, no, there's just no possible way that's happening. The poor kids, even if they really want it, and most kids do, and they're very sincere and they're very really listening and paying attention, they can't possibly do it for themselves. And that's why parents have to do this. It's not going to be successful. I've never seen a child successfully make a change without their parents. And this is even for myself, I look back at my journey, and like I said, I was one child out of 5. And my mom, we just went to a regular checkup, and the doctor said to my mom, you got to get her to stop eating. And, well, first of all, that was really embarrassing for me. And, I still remember it, obviously. So it left some kind of mark. But we went home and we had a little pamphlet that he had given us about the calories of every food. And I was supposed to limit my calories to 1,200 calories a day as a growing 10-year-old. It's crazy, but this was 50 years ago or 40 years ago, I guess. But the thing is, and I know my parents would have probably done anything to help me, they didn't harm me in any way. They didn't make, they never criticized me. They never made me feel bad about it, but we never talked about it, number one. And we didn't change as a family. So my mom was, stay-at-home mom, still making cookies every day, still buying all the things that I love to eat. And then it was left to me to just don't eat that. Right. Have willpower, and as a 10-year-old and moving forward, I just couldn't do that. I couldn't do that. So my message is, let's even leave your child out of this. They don't need to be involved in this discussion. You and I, as the parent, will have this discussion. We'll do everything to help you, the parent, become the parent you want to be and become the healthy role model you want and need to be. Then you will set things up in your house and in your family and in your, according to your family values and your core values. And then naturally your child's health will improve because you've changed.
Yeah. Two things come into my head when you were saying that. So one, if the parents have health issues and maybe obesity, it's going to help them anyway, help them with their own journey. But also, going back to something that I said, a question I asked you at the beginning, if the parents are obese and then they're hearing this advice from you, it seems to me that in some ways it's going to be easier for them to help the child because they're going through the same thing.
Yeah. Yeah, I think so. I think so. Yeah, you can certainly have more empathy. I have some clients who are naturally, the parents are naturally thin.
Right.
And they just cannot even understand. It's hard, I've never been that person. It's hard for me to understand what unnaturally thin, eat whatever you wanted and you have no problem. That has just never been my struggle. But it is sometimes really hard for parents to understand. And the way we've all been socialized over the past many, many years as overweight is a personal problem. There's something wrong with you. You don't have good will. Yeah, I don't know. All of those crazy, crummy things and the bad, the way we made people feel bad about themselves and internalize that stigma. And people are still doing it today, of course. Yeah. So, yeah. And kids are aware of it. Our kids are definitely aware. So, yeah, changing the parents is their health improves, their relationship with their child improves, their relationship with themselves improves. I mean, the whole thing, it's just so amazing. It's what happened to me, and it's just such powerful work, and it's freeing, really. It opens your life.
Well, it's win-win-win, isn't it? Everyone wins.
Yeah.
And so you talked before about health rather than weight. And another angle that I think is better doing it that way is because some people become so fixated on numbers and weighing themselves and the additional stress they put on themselves and so on. And that's the last thing they need, isn't it?
100%. Yeah. Yeah. And, weight is made up of a lot of things. Obviously, bone, muscle, water. And so when you get yourself tied to either having a good day or a bad day based on what your scale is telling you, that's not a way to live your life, not an enjoyable way to live your life. And so, so if we're looking at the big picture and focusing on health, then you are not controlling. What you're doing is you're asking yourself, what does my body need? What would serve my body best? And then you can do that, as opposed to telling yourself, I can't eat that because it's bad for me, or I can't eat that because I'll gain weight, or, And so, we want people to we want kids especially to develop a really healthy relationship with food. And understand that food isn't good or bad. Food is just like various molecules stuck together in different ways. But also have the education that the foods that you're choosing to eat, how they're affecting your body.
Share some practical tips for parents to how to create that kind of culture.
Sure. Well, the advice I like to give is to become the role model the healthy role model in all those habits that we previously talked about. For the parent to kind of try to become that themselves. And so what do? You really need to ask yourself, well, first of all, do I want this for myself? Because there's so many times like it's going to be really hard to make any kind of change if you're not committed to that change. You can work on getting committed to that change. And so there's, that's belief work and, do some of that. But really practical tips are, well, we can even just get away from food because sometimes food is a very touchy subject. Although I will throw in there the most practical tip I can give parents is this should be, in my mind, a no-brainer is eliminate. I mean, I would just try to eliminate it. I hesitate to even say cut back, but like soda, and fruit juice and sugar sweetened beverages, sugar iced tea, Gatorade, all those energy sports drinks. Look at the label and see how much added sugar are in those drinks. And that a lot of it is high fructose corn syrup, Oh, and here's another little tip for parents is that pretty much, well, I tend to feel like a lot of people know that high fructose corn syrup isn't healthy for us. But I don't think a lot of parents know that table sugar or the white sugar you bake with, that's 50% fructose too. So high fructose corn syrup is 55% fructose. Table sugar is 50% fructose. They're the same thing. So, so low hanging fruit, get rid of all those drinks and just drink water or water with lemon or seltzer, something like that.
And you just said fruit juices, and that I think comes as a surprise to many people because many people still have the belief that fruit juice is healthy, don't they?
Marketing. We've all been affected by marketing.
Yeah.
The problem with fruit juice, so natural fruit, like regular fruit is wonderful and wonderful for kids. And I never tell people to limit their fruit. But if you say for orange juice, for example, or apple juice, you put that in a juicer and all you're squeezing out is the liquid sugar. You've left the fiber behind. You've left, a lot of the vitamins and minerals behind. And now you're just getting like a massive sugar load. And so fruit juice is really just liquid sugar. And kids don't need it. Yes, they love it. It tastes good. That's the other thing I think parents need to understand is why do their kids love all these foods?
Yeah.
Well, just like we do, kids love foods with added sugars in them because our human body has evolved over the millions of years to, we get a dopamine hit when we get sugar. That tells us, oh, this is good for us. We should do more of that. This will keep us alive. Keep doing that. So of course, kids love food with sugar. That's been evolutionarily, that has benefited us. That has benefited us right up until about 50 years ago when the companies trying to make money. I don't think people started it from an evil, like, we're going to make everybody sick and overweight and metabolically unhealthy and unwell.
Mm.
Honestly, that is what it's turned into. And this is the water that parents are swimming in, myself included as a mom. My son is 11, like I said, and, he goes to birthday parties. He goes to baseball practice. He goes to soccer practice, all of these things. And usually there's food involved. And it's not food that I would want him to eat. It's food that's these highly processed food. Even at the school, my son's school has really unhealthy or really, I guess the way to put it is foods with ultra processed foods with tons and tons and tons of added sugar. And so this is the water we're swimming in as parents. And also then you add in screen time and sedentary behavior. And then you add in lack of sleep we tend to all get. It doesn't have to be hopeless, and it's not hopeless. And it doesn't have to be overwhelming. So back to your question like 25 minutes ago about practical tips. I pick one thing, start with one thing, and it can be a small thing. So, soda, for example, or, say your child is not getting the recommended amount of sleep. There's really, there's guidelines based on the age of your child, how many hours of sleep. So if you have a 10-year-old child, I can't remember off the top of my head, I think it's somewhere between 10 and 12 hours of a night of sleep. But if for some reason your child is getting 7 hours of sleep, okay, now a parent can think, what do I need to do to assure that he's getting this amount of sleep? And the first step to that, to me, is education. Why is sleep important for a child? Mm. What is the lack of sleep? What is the problem that's creating for him? Yeah. And when parents understand why these healthy habits are so important, that to me, that's like motivation to actually do it.
You commented on the title of the podcast before. So two questions about the title. So then the full title is The Art of Living Proactively, Harnessing the Power of Your Choices. So what does proactive mean to you around health? And also, what do you think of when thinking about harnessing the power of your choices?
Yeah, I love that. And like we were talking before we started recording about the power of that. And that was life changing for me. And I found that I kind of came across that message through coaching, life coaching. Um, but proactive means, to me, it's like, okay, thinking in advance, thinking on purpose. What do I want to do? And, and so there's a life coaching tool, it's a cognitive behavioral therapy model, the think, feel, act cycle. Are you familiar with that? And so, we have a thought that creates a feeling. And then from our feelings, we do or don't do things. So that's our actions. And what at least I'll just speak for myself, what I really wasn't fully aware of, even, as an adult, was that a lot of my thoughts are optional and I can choose my thoughts on purpose. So, the neuroscientists say we have about 60,000 or more thoughts per day kind of zipping along through our brains. And not every one of those thoughts is, well, number one, correct or helpful for us.
Yeah.
So when you learn to get a little bit of distance and create a little bit of awareness about what you're currently thinking and the results that thinking is creating in your life, then you can decide on purpose, proactively, do I want to keep that thought? Or would it benefit me to shift that thought or change that thought, and get to a new thought that's going to give me the feeling that I want, that's going to give me the results I want, or give me the actions I want that are going to give me the results. So that's the harnessing the power of your mind kind of thing, and parents can do that. For me, like I say, how do I want on purpose? Like, how do I want to be thinking about, well, number one, thinking about myself as a parent. What are the thoughts I want to have about myself? I want to have thoughts that I'm doing the best that I can. I'm committed to my son. I'm committed to his health, whatever this is very individual, but this is the work of coaching. And then you can do the same thing with food and thinking on purpose, like what foods do we want to eat? And certainly exercise and sleep, all of the things. I mean, your whole life, your job, your relationship. How do I want to feel about my partner? How do I want to feel about my child? And then you go back and you figure out the thoughts you need to have so that you feel how you want to feel about the person you're talking about. It's so freeing and amazing.
As a coach, I mean, what you just said there about, we have so many thoughts and not all of them are true. We don't have to believe all of them. But it seems to me a lot of people don't realize that. So when you're working with someone, how do you help them to actually realize that? And not just, it's easy for someone to hear that and then they've forgotten about it by tomorrow. How can you help someone to really remember that not all of their thoughts are true?
Yeah, so you can, so it is a process and process, I guess. So it's not just one thing, one time, and you're like cured of your, thought errors forever. You just realize like, oh, this is my brain. This is how my brain works. Okay, this is the thought I'm having. And then you can, look at it. Sometimes I think of it like, in the grocery store, like the conveyor belts going down the line and the person scanning, your item. But our thoughts are kind of like that too. And you can pick up your thought and be like, even ask yourself, is this thought even true? Like, and you can poke holes in your own story about what you're telling yourself that this thought is true, So that's, but first of all, you have to have the willingness to do that. And then second of all, it takes just practice and understanding, like, oh, I say to myself all the time, like, I think that was a thought error on my part. Just like, I'm like, it just came to me, but I don't think that's correct. I don't think that that's correct, number one, but also like, and I don't make that mean anything bad about myself. Oh, that's just my human brain. That's just, we know that our brains are constantly, all our brains are doing is trying to keep us safe and trying to keep us as happy as possible. And that's their job, to keep us alive. So, but here in today's world, we can actually, kind of harness the power of our brain. And, we have two parts, like the primitive brain and then the prefrontal cortex. So our primitive brain is trying to, keep us happy, keep us alive. And our prefrontal brain is the brain that we can harness if we choose to, if we even know that it's a possibility to achieve our goals, set our goals, achieve our goals, live the life we want.
Is there a book that comes to mind that has really moved you for any reason?
Well, I wouldn't be able to speak about it because I haven't reread it in so long, but I read a book of short stories called The Interpreter of the Maladies by Jhumpa Lahiri a while ago. And like I said, because I haven't reread it, I wouldn't be able to say, but there was something about that book that has stuck with me. It changed me when I read it. I think she's just a wonderful author. And most recently, and this is in line with the work that I do, the most life-changing book I've read has been called The Obesity Code by Dr. Jason Fung. And that shifted some medical beliefs I had, some biological beliefs. I learned so much new information that's been helpful. It changed my whole life, actually. So that's a book I think anybody could read, especially if you're struggling with extra weight. And it's pretty life-changing.
He's got a great way of describing diabetes and the way that insulin works in the blood and so on. I love the way he describes it.
Yeah, exactly right. Yeah. And that's called the carbohydrate insulin model of weight gain and weight loss. And, when I changed the way I was eating based on trying to keep my insulin level low, I lost 40 pounds. And so I think that that's what's going on in our society today, just because of the food world we live in. A lot of doctors like myself, we were trained in the calories in, calories out model, which is entirely unhelpful and is what's keeping people really stuck. So that book, I highly recommend that book to everybody.
So if people want to find out more about you, maybe to work with you, to get more information about some of the things you do, where would they go?
I have a website. It's my whole name, SheilaCarrollMD.com.
Okay.
That's probably the easiest thing, and you can email me from that website.
And if you look in the show notes, we'll have Sheila's social media handles and stuff. They'll all be there. So just the last thing I always ask is there a quote that stays with you for any reason?
Yes. And it's a quote by Byron Katie. I'm probably going to mess it up because I didn't have it written down, but it's basically like, I wrote it down. Do you have it written there?
When I argue with reality, I lose, but only 100% of the time.
Don't you love that quote? Yeah. And the reason why I love that quote, when I argue with reality, I lose, but only 100% of the time. I just through life, like all of us, we go through, challenges, life challenges. And I found for myself, I kind of created a lot of extra challenge, extra pain, on top of the normal pain that I would have had from having that experience, because I was arguing with reality, saying this never should have happened. It shouldn't have been like this. That this person shouldn't do this. Da 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 da. And when I read that quote and really thought about it and really kind of it took me time. It takes time to think about that over and over and ask myself, in what ways am I arguing with reality and adding to my own suffering? And so I just find that quote so powerful because it's just freeing so what do we do when we stop arguing with reality, we can accept, doesn't mean we have to love it, but at least we're not beating ourselves up or, kind of hurting ourselves by continuing to, argue against it.
It's interesting that you say we didn't have to love it, or we don't have to love it. Because there's a quote by Nietzsche, and I can't remember how to pronounce his name, but the philosopher. And his quote is, or amor fati, which is love your fate or love thy fate.
Yes.
And he's basically saying exactly the same thing, but he says you should love your fate, even if it's something bad. Because, well, for one, there's no point in arguing with it. It's already happened.
Right.
But just it's accepting whatever happens to you, even if it's something bad. Yeah. It may be bad in the present, but maybe in the future, there was a good reason for that, or it brought good things or whatever.
Yeah. Yeah. And honestly, like maybe there's never a positive outcome, or you're never able to shift it. But also if you can just accept that and sit with that acceptance, at least you're not making your own suffering worse.
Yeah, exactly.
And I used to do that to myself all the time. I had a miscarriage and I just remember, I didn't know this at the time and I'd never heard this quote. And I added so much kind of quote, dirty pain to the clean pain of losing a baby. And then adding on, I just was like, refused. How did this happen? Why did this happen? This never should have happened. And it was like torture. I was torturing myself.
Yeah.
And I didn't know any better, So that's the other thing I love teaching parents about is, some of these emotional skills. And so how can parents teach their kids to sit and accept these negative emotions and accept them in their body and deal with it? Meaning like deal with it in a healthy way or manage it. So because so much of things that we do, overeating, over scrolling on social media, over shopping, over drinking, we are essentially trying to get away from some negative emotions. And if we can teach our kids, well, first you have to learn yourself, but you can learn how to be with your emotion, process your emotion, and then it just kind of flows through you, and you don't become, reactive to it, especially in a way that's negative and impacts you and your health or your relationships in a negative way. So I love teaching parents that as well.
Well, Sheila, we have run out of time. It's been a pleasure. So thank you for your time.
Not a lot.
And for helping people with some really important issues, especially with children, which is, obviously so important. So thank you.
Thank you. Thanks for having me on your show. Appreciate it.
Next week, episode 234 with Jodie Claristenfeld. And we discuss her organisation, Flourish, which provides support and resources for parents of premature babies and NICU graduates. After Jodie's own traumatic experience having her daughter born 12 weeks early, she recognised a lack of community and information for those parents. And through Flourish, she offers peer support groups, expert advice and practical guidance to help parents navigate their child's medical needs and developmental delays. And she advocates for securing necessary therapies and tailored education so these children can flourish. And she stresses about being proactive, thinking ahead, asking questions, and putting kids in the best position to thrive at each stage. So we talk about that and a lot more. That's next week's episode 234 with Jodie Claristenfeld. I hope you enjoyed this week's episode. Please do leave us a review, subscribe, and I hope you have a magnificent week.